Good morning to all of those who make this broadcast possible, to Raul, who joins us today, to our sign language interpreter, and to everyone tuning into our briefing each morning. Today, 1,519 people are hospitalized in Cuba. 56 are under observation. There are 857 suspected cases and 606 confirmed active cases, a high number compared to what we have seen previously. Yesterday, 3,646 samples were processed in our various molecular biology laboratories. 1,187 were processed at the Pedro Curie Tropical Medicine Institute, 664 in Havana's Hygiene, Epidemiology and Microbiology Center, 509 in Villa Claras, 285 in Santiago de Cubas, 658 in the Genetic Engineering and Biotechnology Center Lab, 222 in the Hermanos Almajeres Hospital Laboratory, and 121 in the Civil Defense Laboratories. Of the 3,646 samples processed, 24 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 327,689, of which 3,316, or 1.01%, have tested positive for the virus. Of the 24 positive cases diagnosed yesterday, all are Cubans. Of these, 21 are confirmed case contacts. This means that confirmed case contacts account for 84% of all diagnosed cases since the start of the pandemic, representing the highest risk group. That is why it is so important to isolate case contacts. For example, I test positive. That means that everyone I have had contact with, be it close or not, must be isolated until they can be tested for the virus. Of the 24 cases diagnosed yesterday, the source of infection linked to 3 is yet to be determined. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 204, or 6.2% of all confirmed cases. Meanwhile, none of the people who tested positive for the virus yesterday contracted it abroad, meaning that imported cases remain at 318. More women than men tested positive for the virus yesterday. For 5 men, representing 50.1% of all cases, and 16 women, for 49.9% of all diagnosed cases. A similar rate between both sexes. 10 of the 24 were asymptomatic at the time of testing. This is a slight change in the trend we have been seeing here in Cuba. Overall, however, these cases account for 57.7% of all positive cases on the island. When we look at this figure over the last 15 days, it stands at 89.1%. By age group, 3 positive cases yesterday are under the age of 20. 11 are between 20 and 40 years of age, 6 are between 41 and 60, and 4 are over the age of 60. Of the 24 positive cases yesterday, which, as I previously mentioned, are all Cubans, 22 belong to Havana, and the municipalities of Arroyo Naranjo with 5 cases, San Miguel with 4, Boyeros 3, Plaza 2, Cerro 2, Marianao 2, and 1 case from Habana del Este, Playa, La Habana Vieja, and La Lisa. Notice how widely spread cases are throughout Havana, meaning that we must ensure that we are rigorously complying with all measures. 1 case was diagnosed from Artemisa and the municipality of Mariel. This case is linked to the recent outbreak in the area. 1 other case was also diagnosed in Cárdenas, Matanzas, the source of infection linked to which is still being investigated. Yesterday's results by province mean that Cuba's confirmed case rate per 100,000 inhabitants since the start of the pandemic stands at 27.9. If we look at this figure over the last 15 days, despite being lower than yesterday's, we can see that Artemisa continues to be the province with the highest rate of confirmed cases, registering 22.33 per 100,000 inhabitants. Havana follows with a rate of 19.44, slightly higher than yesterday's. Then Villa Clara with 2.83, lower than yesterday's. Pinar del Rio has a rate of 0.86, Las Tunas with 0.37, Matanzas with 0.28, higher than yesterday's figure, and Mayabeque with a rate of 0.26. To date, in Cuba, 49 episodes of local transmission have occurred, of which 11 are open, ongoing events and are located in Havana, Artemisa, and Villa Clara. To summarize, of the 3,316 people who have been diagnosed with the virus thus far in Cuba, 606, or 18.3%, are active hospitalized cases, a high number, as you can see. 601, or 99.2%, are clinically stable. No COVID-19 related deaths have been reported in Cuba in recent days, for a mortality rate of 2.65%, which, compared with the regional rate of 3.62%, places Cuba in 21st position in the Americas. When we compare Cuba's rate with that of the world, which stands at 3.58%, the island occupies 113th place globally. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 52 people were discharged from hospital, a positive result achieved through the hard work of our healthcare professionals, and representing more than double the number of confirmed cases reported yesterday. This means that, to date, 2,620 people, or 79.1% of all confirmed cases in Cuba, have recovered from the virus. Of the 606 hospitalized patients, 3 continue to be in a critical state in our intensive care units, while 2 are reported as serious. The critical patients are the same reported yesterday, while today there is 1 more patient than yesterday reported as serious. All are from Havana. This is the situation in Cuba, with important episodes of local transmission in Havana, a couple of municipalities in Artemisa, and some in Villa Clara. But we are working hard and will continue doing so in order to control these episodes, and we are confident that we will be able to control them. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 312,886 people were diagnosed with the virus, for a total of 21,213,649 since the start of the pandemic. 11,063 people died of the virus yesterday, for a total of 760,421 and a mortality rate of 3.58%. The region of the Americas, which accounts for 53.98%, practically 54% of all COVID-19 cases worldwide, reported 160,949 new cases yesterday, for a total of 11,452,870 confirmed cases. Yesterday, 4,001 people died of the virus in the region, bringing the COVID-19 death toll in the Americas to 415,130 and a mortality rate of 3.62%. Just like yesterday, the United States continues to top the list of countries with the highest number of COVID-19 cases, with a total of 5,313,080 and 168,446 fatalities. Once again, over 1,000 deaths occurred in the US yesterday, 1,336. Brazil follows with 3,275,520 confirmed cases and over 1,000 fatalities yesterday, 1,060, for a total of 106,523 COVID-19 related fatalities in the country. Then comes India, Russia, South Africa, Peru, Mexico, Colombia, and Chile. This is the information that we have on the behavior of the pandemic in Cuba and the world.